Hi, welcome to the summary, the conclusion of our series on brain health, and we're going to kind of pull it all together about why this was such an important series. I have some statistics in addition to the ones I shared earlier, but 1 in 10 American adults is feeling depressed. That's a lot. And so here's some interesting information. Living in a particular state can raise your risk of feeling depressed. There were certain areas of the United States that there are more people dealing with depression than in other states. Certainly women, this is kind of a statistic that's pretty well known. Women are at greater risk for dealing with anxiety and depression than men. And I found this statistic interesting. Between the ages of 45 to 64, your risk of depression, and we're casual here. We'll handle a phone call and I'll keep talking.
Yes,
45 to 64, that age category tends to have a greater risk of experiencing depression. This is a very sad statistic. 1 in 10 women will experience postpartum depression. And that tends to be a really difficult one to handle because you're dealing with a very demanding life change. You're dealing with an infant and you're feeling very low, anxious, not good sensations when you're dealing with a brand new infant. So what are some of the situations that you might experience and can attribute to low mood, depression, and anxiety? If your appetite changes, if you're feeling hopeless, really pessimistic, you can't find the bright side of any day, maybe you're dealing with insomnia, possibly sleeping too much, feeling very lethargic. You have an ongoing sensation of sadness. These are all situations that you may be experiencing and looking for solutions and hoping that you will find some of those solutions in our series. Dr. Slavin, are you back?
I'm back.
Okay,
So
good.
it's not a prozac deficiency that they're experiencing, because the way doctors treat patients, you would think that's what the problem is.
Unfortunately, and I think I really want to be very clear that I don't have anything against those pharmaceuticals. And if you read about the information from the manufacturer on those pharmaceuticals, they were meant for short-term use. So I talk to people about using them as a bridge until you change the underlying basic body chemistry that contributes to that brain dysfunction.
Not only that, if you read the adverse effects associated with them, you have many of the problems that you're giving the drug for listed under adverse effects.
Right.
So if someone feels suicidal, well, that could be one of the side effects is suicide. I think it's been reported that many of the mass shootings, the perpetrators were on these types of drugs. So it just makes sense to me and to you, and I hope our viewers, that not addressing the underlying cause of the problem makes no sense. And if you address the underlying cause, you won't need to take the drug. Correct the thyroid problems, the sex hormone problems, the nutritional problems, and in the majority of cases, you're going to get better and you're not going to need the drug. And what I observed is once these people get on these drugs, they're afraid to stop. Because they do make you better, feel better in many cases, and they're afraid to go back to how they used to feel, even though that can be attained if they correct the underlying problem.
So by understanding what testing there is available, and you can identify the area where you need to focus your effort. So it could be with using certain amino acids to create a change in neurochemistry, raising GABA levels, raising serotonin levels. So that knowing about the testing that can identify the problem is very helpful. And to understand that there are readily available natural substances that are very efficient, and you see the change in a very short period of time. One of the areas that we didn't talk about as a solution, and my experience has been that it works literally overnight for some people, is SAMe. SAMe can make a dramatic shift in your mood, in your sensation of anxiety. So there are so many tests that are right on target to identify where you need to focus, and there are so many natural, readily available, very affordable approaches that you can use to minimize any of those symptoms that I was talking about.
And if we haven't mentioned it already, regular exercise is important.
So important, very
And I think I came across a recent statistic about how few adults have regular exercise. You know, it's not done that often. Now, earlier you mentioned just how common depression is. What age group are they seeing it?
Okay, it's interesting because your risk for feeling low mood, anxiety, and depression in the age category 45 to 64. What that made me think about was what you just mentioned about hormones and the hormone changes that many people are experiencing during that age category.
And in fact, you said mostly in women?
Yes.
Majority, and
Yes.
you know, because they seem to be affected the most by hormonal changes. And giving a perfect example of a person who recently had a baby, and after the baby they put in an IUD, one of these hormonal IUDs,
Oh, gee.
and the complaint is severe depression.
Wow.
My recommendation was get the IUD out without the hormones, because it's totally unnatural to take a hormone that way.
I remember when IUDs were first introduced, unfortunately, things have changed dramatically, that it was just the intrauterine device itself and not necessarily combined with a hormonal
Right.
component.
Yeah,
So
I said if you have to use an IUD, no chemicals with it, just use the IUD.
So we have so many different approaches that you can use to support your good health, but very specifically get your brain right where you want it to be. And we've presented these over this series on brain health, and I hope that it has been beneficial, and we'd love to have you subscribe to these health care hoax videos and certainly share them, and to let us know that you liked the information that we've shared. And we will be back soon with more on a variety of different health challenges and giving you that profile of information, introducing the subject, talking about the causes, the solutions, the testing, and then putting together a summary of everything you need to know in order to achieve great health. And we'll be back with more on healthcare hoax videos. Thanks for watching.